Mom, what's wrong?
My arm.
I'm gonna call 911. My mom, yeah, she's having a hard time moving her right arm. We think she's having a stroke.
Thanks to a class Rosie had taken, she knew that sudden weakness and numbness in her arm are signs of a stroke. During evaluation, paramedics may ask if you are experiencing any other common stroke symptoms. Because Rosie is a female and over 55 years old, she is at a higher risk for stroke in general, and as a result has taken steps to manage her modifiable risk factors, which are diabetes and high blood pressure. Now that Rosie is in the emergency room, the stroke care team will go over her medications and medical history, identify the last time she was completely normal, review the assessment by EMS, and perform a head-to-toe assessment, including a focused neurologic exam. Additional tests will be ordered to confirm how best to proceed. Common tests include blood work and a CT scan, which is what Rosie's doctor has ordered. The two main types of stroke are ischemic and hemorrhagic. Ischemic strokes are the most common and are the result of a blood clot or plaque blocking blood flow to an area of the brain. Hemorrhagic strokes occur when blood leaks into the brain tissue or around the brain.
Rosie, it looks like you're having an ischemic stroke, but because you recognized the symptoms, called 911 and got here so quickly, we're able to use a clot-busting medicine called TPA to try to break that blood clot up and restore blood flow to your brain. Like any medicine we use, there are risks, and the biggest risk is bleeding. But given your history, the kind of stroke you're having, and how quickly you got here, I think you're a very good candidate for the medication. Are you okay with us going ahead and giving you that medicine to try to stop this stroke?
Yes.
There are also other methods available for the treatment of ischemic strokes, such as mechanical thrombectomy, which can be used to remove the clot. If Rosie had a hemorrhagic stroke, medication to lower her blood pressure or surgery may be treatment options.
Following her initial treatment, Rosie will be closely monitored for at least the next 24 hours in the hospital. Her medical team will begin to evaluate the reasons why she had a stroke and make recommendations for needed follow-up care. Most stroke survivors will follow up with their primary care provider and a neurologist after a stroke. Many will need some therapy to aid in the recovery process. With help of common therapies, including physical therapy, occupational therapy, and speech-language therapy, improvements can still happen even 2 years after a stroke.
It is important to keep in mind that even with quick action and excellent medical care, stroke can be a life-threatening medical event. Knowing the signs and symptoms of stroke, calling 911, and telling the operator that you suspect a stroke can all make a considerable impact on your outcome, because when it comes to stroke, every second counts. To easily remember how to spot a stroke, remember FAST. F is for face. Does one side of the face droop? A is for arms. Does one arm drift downward? S is for speech. Is their speech slurred or strange? And T is for time. If you observe any of these signs, it is time to call 911 immediately. Remember, stroke is an emergency. Be sure to educate yourself about stroke now and know that you can take steps to manage your stroke risk.
Making lifestyle changes such as healthier eating habits, increasing your physical activity, and quitting use of tobacco can all make a big difference. If you have medical risk factors, taking all your medications as prescribed by your provider and going for regular checkups are key to reducing your risk for a stroke. Be sure to take steps to reduce your risk for stroke today.